I even got the class.
Okay.
I had to draw it.
What?
Chemistry?
Okay, ready?
Oh,
So,
so bad.
Yeah, I'll take a second.
Sorry.
okay. So, yeah, here's the female. So on the outside, what you can see is, we'll start from the top down, I guess. So we have the red area here is the fimbriae, which is the very distal part of the fallopian tube, and then back away from it is the infundibulum, okay? Then when we get, I guess it's kind of hard to follow this one. It kind of disappears here, actually here. So infundibulum, there are three parts, infundibulum, ampulla, and isthmus. But actually on this model, just call it fallopian tube, or uterine tube is just fine. But this part on the very edge you should definitely call fimbriae. This is the ovary, okay? And this is going to lead to the uterus, so all this is uterus. And if you can kind of see, I don't know how well this is going to show up on your video, but there's a little tube that connects the ovary over to the uterus. This structure here, that's your ovarian ligament, okay? So if you can see it, this right here, here's your ovarian ligament, okay? Then, so your uterus, your urinary bladder, and coming down from the uterus, we can see the vagina. So this is, the tube is the vagina. Then as you come exteriorly, what you can see is these are all glands, these blue things, which we didn't cover. Here, this inner fold, this is the labia minora. Here, this larger fold is labia majora. Here is our pad of fat, that's the mons pubis. If we want to open up this one, you can see more. There's also an ovary and a fallopian tube inside this model. You can see the inside of the uterus now, so there's three parts to it. The perimetrium in white, the myometrium, all this flesh-colored part, and then the endometrium is in pink. Okay, so the very pink inner layer. So the uterus goes down, and the most inferior part of the uterus is the cervix. The cervix has a little opening called the os. All of this space here and down is the vagina. Here is, again, the urinary bladder. The detrusor muscle is what you call the muscle of the bladder. You can see the urethra, okay? This blue thing is a pubic symphysis, so the bladder sits behind the pubic symphysis there. Other things are the rectum, and you can see the external anal sphincter here. And that's it for the female reproductive model. And then the male here. So the male, the largest thing you can see is the bladder, okay, urinary bladder. On the inferior surface of the bladder, posterior surface, I should say, posterior surface, we have the seminal vesicle. We have a prostate gland down here. We can see that the vas deferens comes up over the bladder and goes around to the posterior bladder. Okay. So that's basically structures from the outside. If you wanted to lift, oh, actually, let's talk about here. So here's the scrotum is the skin, the testicle inside, the epididymis on top of the testicle. Here's your vas deferens. Okay, here are your testicular vein and artery. All structures together are spermatic cord, okay, but you're missing nerve and lymphatics. The penis, we have body and we have glans penis. We take this off. You can see inside, you can see the rugae of the bladder, the detrusor muscle of the bladder. You can actually see, oh, actually I should point out here that the urethra, oops, it's the wrong way. This guy sticking up is the ureter, okay? And you can kind of also see a ureter coming down here. So this is the ureter also. So this is the urethra all the way down, right? But the male urethra is split into three parts. So the part of the urethra that goes through the prostate, which is this red structure wrapped in purple, but this is the prostatic urethra. This muscle is the urogenital diaphragm. So the part of the urethra that goes through that diaphragm is the membranous urethra. And as it goes down into the penis, it's called the spongy urethra because the tissue right around the urethra is called corpus spongiosum. In here, so this little offshoot from this prostatic urethra, that's your ejaculatory duct. Okay, so urine doesn't go in this area, only sperm and the semen. Okay, so then we have in the penis, we have the purple, light purple outer tissue is corpus cavernosum. Around the urethra is corpus spongiosum. The glans penis here, you can see the skin continues over it. So the skin here is called the foreskin or prepuce, okay? The scrotum, again, you can see the testicle inside. These little holes represent the seminiferous tubules, and this upper part that represents the epididymis, and then this muscle around it, I believe, is the dartos muscle. Okay, and here's the rectum and the external anal sphincter here, and that's it.